Burnout among healthcare workers has been something that's been plaguing hospitals and clinics since the start of the pandemic. But Christina, the number of workers is still continuing to skyrocket even at the start of this year.
Well, Jelena, that's absolutely right. But for the pandemic, burnout rates on average range from around 30% to 50%. But now rates are ranging from 40% to 70%. These rates are expected to actually continue to go up.
At the start of the coronavirus pandemic, there was a burnout, or in other words, work exhaustion among healthcare workers in hospitals and clinics. Studies show before the pandemic, burnout rates on average were ranged from 30% to 50%. But now, rates range from 40% to 70%. And with the presence of the new Omicron variant, these numbers will only go up. This contagious variant is not only bringing in more infected patients, but it also is getting these workers sick as well.
These workers, these pharmacy technicians and pharmacists are working their tails off, but they're tired.
And when it comes to burnout in healthcare, it is affecting everyone, from doctors working longer hours than usual in different capacities to nurses having to work possibly more than 24-hour days, which is only requiring them to meet more needs than they normally have to. And result causes many workers to walk away from the profession because they're suffering from depression, anxiety, PTSD, and other symptoms.
Right now, we are already strained, and you take that next 2 weeks and add that in, we have the risk of the system coming to a complete standstill.
And at this point, healthcare workers have to just keep doing what they are at this time. That's coming together and using the help that they do have.
And if you are experiencing burnout, it is important to try your best to really take care of yourself, whether that means talking with someone, seeking help, or practicing your own mindfulness at home.